Have you ever stared at a list of insanely complex medical terms and felt like you were trying to read, I don't know, an entirely different language? Yeah, we've all been there. Medical terminology can be incredibly dense, and trying to memorize the distinct presentations of different anatomical conditions, it's a massive challenge. But what if you didn't have to rely on just brute force memorization? Welcome to today's Explainer. We're going to take some really heavy medical text and transform it into vivid, unforgettable mental imagery.
So, whether you're a medical student cramming for your board exams, a nursing student prepping for clinicals, or really just a health-conscious person who wants to understand the human body a bit better, visual word association is going to be your absolute secret weapon. It's brilliant. By linking a clinical name to a highly visual and, sometimes a slightly bizarre mental picture, you actually bypass the rote memorization part of your brain. You tap straight into instant recall. Today, we're focusing this technique on 3 distinct testicular conditions.
Okay, let's look at the agenda for today. First, we'll cover the power of visual memory. Then we'll dive into varicocele, vines and veins, followed by hydrocele, the water balloon. After that, we'll look at torsion, the twisting clock, and we'll wrap it all up with a final comparative review.
All right, let's jump right into our first condition, varicocele, vines and veins.
Now, for this one, I want you to keep a grounded, steady mindset. This is a chronic issue that develops over time, okay? It's not a sudden red alert emergency. So here is your first mental mantra. I literally want you to say it slowly in your head right now. Vari equals vine equals veins equals worms. To lock this in, visualize a cluster of thick grapevines wrapped tightly around the testicle. Or if it works better for you, picture a literal bag of grapes or even a bag of worms hanging heavily just above it. The trick here is that whenever you see the prefix vari, your brain should instantly flash to those twisting, lumpy vines. So let's see how this builds into the actual clinical facts. Those vines you just visualized, they represent dilated veins, specifically the pampiniform plexus, which is just the fancy name for the network of veins in the scrotum. When a doctor actually examines a varicocele, they almost always describe it using that exact visceral phrase. They say it feels like a bag of worms. It also almost exclusively presents on the left side, and that's just due to the specific anatomical angle at which the left testicular vein enters the renal vein. Now think about gravity for a second. Because this is an issue of blood pooling in the veins, it makes perfect sense that it gets way worse, much more pronounced when the patient is standing up. And conversely, it improves when they lie down so the blood can finally drain. While it's usually not an emergency, that pooling blood generates excess heat, which is why a varicocele can unfortunately lead to infertility.
Moving on to Section 3, hydrocele, the water balloon. Let's take a deep breath, shift gears, and actually lighten things up a bit for our second condition. This one is entirely different in its physical makeup. It's fluid-based, smooth, and honestly, generally painless. Our memory mantra for this one is hydro equals water equals glows. The prefix hydro is a total gift in medical terminology because it always, without fail, means water. For this mental picture, I want you to visualize a brightly colored water balloon completely surrounding the testicle, encasing it in a nice layer of clear fluid.
So, what does this water balloon actually look like in a patient? Well, it presents as a collection of fluid around the testis. Unlike the lumpy, uneven bag of worms we just talked about with a varicocele, a hydrocele presents as a very smooth swelling. The tension is incredibly even, literally just like a filled balloon, and it's usually completely painless. The patient might feel some heaviness, sure, but no sharp pain.
Now, what's really interesting here is an incredible diagnostic trick you can do right at the bedside. Imagine taking a flashlight or a medical torch and pressing it against a water balloon in a dark room. The light brilliantly scatters and shines right through the clear water, right? It makes the whole balloon glow. Well, this is called transillumination. Because a hydrocele is filled with clear fluid, it will transilluminate. A solid mass or a tangle of veins, they definitely won't do that. So just remember, hydro equals water equals glows.
Okay, Section 4, torsion, the twisting clock.
Listen, I need you to mentally switch gears right now. The relaxed, chronic conditions, they're behind us. We are entering the territory of a terrifying surgical emergency. This is something that requires rapid recognition and absolute immediate action. Your memory sentence here needs to feel urgent. Torsion equals twist equals time equals surgery. The word torsion inherently sounds like twisting, doesn't it? I want you to imagine a thick rope being twisted violently around a delicate cord, completely cutting off everything inside it. Or picture someone grabbing a soaking wet towel and wringing it out with maximum force. That violent twisting is exactly what's happening to the spermatic cord, and it is completely cutting off the blood supply to the testicle.
Because the blood supply is suddenly choked off, the symptoms are, as you'd guess, super dramatic. The patient is going to experience sudden, severe, and agonizing pain. There is absolutely no gradual onset here. And because the cord is twisted and shortened, the testicle is actually pulled upward, resulting in what we call a high-riding testis. Another massive red flag to look out for is the absent cremasteric reflex. Normally, if you lightly stroke the inner thigh, it causes the testicle to retract upward, but in torsion, that reflex is completely gone. The pain is so visceral and intense that it frequently triggers intense nausea and vomiting. Make no mistake, guys, this is a major surgical emergency.
So, the absolutely crucial point here is this number, 6. You have a strict, ticking clock window of about 6 hours to get this patient into an operating room, untwist that cord, and restore the blood flow. If surgery is delayed beyond that 6-hour window, the testicular tissue literally dies from lack of oxygen, and the testicle cannot be saved. Let it sink in. Torsion equals twist equals time equals surgery.
Finally, Section 5, the final comparative review.
Okay, let's take a breath, let that adrenaline fade a bit, and step back into a clear, analytical mindset. We've built 3 very distinct mental images today: the twisting grapevines, the glowing water balloon, and the aggressively wrung-out towel. Let's synthesize all this data and separate these conditions side by side. First, look at the pain levels. Varicocele is a dull ache that gets worse with gravity when you stand. Hydrocele is essentially painless, just a smooth, glowing swelling. But torsion is sudden, severe, nauseating pain. Now, look over at the emergency column. Varicoceles and hydroceles give you plenty of time to think, evaluate, and plan outpatient care. Torsion demands you drop absolutely everything and call the surgeon immediately because you only have those 6 hours. By anchoring the clinical facts to these vivid visual mnemonics, you aren't just memorizing lists anymore, you are recognizing patterns, and that is a real game changer. As we wrap up this explainer, I want to leave you with a quick challenge to test that mental palace we just built together. Without rewinding, ask yourself, which of these conditions requires emergency surgery within a strict 6-hour window, and what specific absent bodily reflex is the major red flag identifying it? If you can instantly picture that wrung-out towel and remember the answer, then your visual memory retention is already working perfectly. Keep building those visual associations, and I'll see you in the next explainer.